Hey guys, assalamu alaikum. It's Dr. Faraz Ahmad, and today in this video we will talk about reading part A. Guys, as you know that in last 2 or 3 exams, OET reading subtest particularly is coming very difficult. And in the trading part, if you attempt reading part A very well, if you score almost 20 or 19 marks in reading part A, then there are a lot of chances that you can pass OET reading exam. So in this video today I will tell you that how you can attempt reading part A in just 12 to 13 minutes. Actually in reading part A time is the main issue. So in this video I will tell you 2 strategies how you can attempt part A in just 12 to 13 minutes. So in this way at the end of part A you will have 1 or 2 minutes and you can check your part A if there is any mistake. So guys, please watch the video till end so you can attempt your part A in a better way. Okay. So first of all, let me tell you that OET reading part basically consists of 3 parts, 42 questions, and you have to score 30 to get B in your reading part. And total time for reading subtest is 1 hour. So in this video we will particularly talk about reading part A. While you are going to attempt reading part A, you should keep in mind 4 text, 15 minutes and 20 questions. This is very important. 15 minutes, just 15 minutes and 20 question is very important. You should keep this in mind. Okay, so reading part A, 4 text, basically 4 texts are given on the same topic. In the first text there may be some definition of some medical condition. In text B there may be some presentation or hospital admission about that condition. In the third text there may be some investigation, and in the last text D or text 4 management of that condition would be given. Okay, so you should keep in mind that 4 text on same topic may include simple text, there may be some flow chart, there may be some diagram, or there may be some table as well. So 15 minutes and 20 question. So guys, keep in mind part A is most easiest part of reading subtest, but here what is the important thing which matter? It is time. So time is the most important thing which matters a lot in reading part A, although it's most easiest part of the exam. And keep in mind that most of the time your reading result depends upon reading part A. If you are going to score a very good score, almost 19 or 20 in reading part A, then there are a lot of chances that you pass your reading exam. If someone unfortunately is unable to score very good marks in part A, then there are very less chances that he can pass reading part A. So guys, this is an important point here as well. Most of the students think that reading part A will be with them for whole 1 hour. No, keep in mind that part A is for only 15 minutes, and after 15 minutes part A paper will be collected back after these 15 minutes. Okay, so guys, in OET reading part A there are basically 3 type of questions, in which first 7 questions are matching type of question. You will read the 4 text, and in the first 7 question they will ask you that how to assess chest pain. It's mean they are asking about the text where the assessment of chest pain is mentioned. Then you will read the text and you will answer part C. You will answer C. That's mean in text C. They can ask management of the chest pain. Then you will see in the text that where the management is mentioned, then you will see definitely it is in text D. Then you will just write D. So these are first 7 questions in reading part A. Okay, so guys, it's better to answer these questions at the end of the reading part A, because once you will have done with reading part A, at the end you will have a better idea that where assessment, where management, where presentation and where definitions are given. So I will suggest that you should attempt these 7 questions at the end. Okay. Secondly, question 8 to 14, these are short answer type of questions. Let me tell you how. Answer may include a word, number, or both from any of the four texts. Basically, these are short answer type of questions. For example, what is the main symptom of angina pectoris? Basically, this symptom will be given in any of the four texts as they are talking about the symptoms. So this answer of this question will be given in the text where symptoms of angina or MI will be mentioned. Okay, so in this way you can answer the question. Second, sixth question, that is question 15 to 20, will be fill in the blank type of question. For example, dash contribute to vasoconstriction and platelet activation. So you will search for important words in the text that are vasoconstriction and platelet activation. So when you will find these important words, then you can find the answer, and according to the text the answer of this question is cigarette smoking. So let's move to the strategies. Now I will tell you that how you can attempt OET reading part A in just 12 minutes. So guys, as I have already told you, that keep in mind 4 text, 15 minutes and 20 questions. So there are 2 methods by which you can attempt reading part A in 12 to 13 minutes with maximum score. Definitely, if you are going to complete your reading part A in given time, then you will be satisfied and you can score maximum up to 20 by 20. Okay, so guys, this is method number 1. So guys, as in the previous methods, most of the people do what they skim and scan the text first of all, then they move to the questions. But no, I will tell you that how you can do your part A in minimum time. So method number 1, there is no need to skim and scan each line of all the 4 text. There is no need to skim and scan 4 text, each line of the 4 text in start. First of all, what you have to do, just leave all the 4 text and first 7 question. Don't touch any of the text from 4 text and first 7 questions. What you have to do, directly move to the question number 8 and start reading question 8 to 20. What you have to do when reading part A will be given to you, directly move to question number 8 and start reading question 8 to 20. Here is important point. What you have to do, you have to skim and scan the questions for important point or word given in the question. There is no need to skim and scan the text. You have to skim and scan all the questions for important word or point which is being asked in the question. So once you will have a skim and scanning of the questions, then you will have a very good or better idea that what type of the information you have to search from the text. Are you getting me? So guys, I will suggest that try to read all the questions just in 1 minute and 30 seconds. Now keep in mind that in just 1 minute and 30 seconds you have read all the questions. Okay, so while you are reading the question, encircle or underline the important point or word which is key in the question and try to remember that point. If you will have that point or word in your mind, then while you will move to the text, you can easily pick the answer. Okay. So guys, now move to the text and quickly search for the important point or word which were asked in the question and you have encircled it. Now in the text, you will search only for those important words which you have underlined or encircled. You will not underline or encircle the whole of the text. In this way, you can save your a lot of time. Are you getting me? After encircling, after reading the important word from the question, you will search for that word or that important point in the text. You will not encircle or you will not scan whole of the text. This is very important. Okay, in this way you will underline and encircle only the important point being asked in the question. Try to read all the four text for the relevant information maximum in 4 minutes. So guys, in this way, if you will skim and scan the text only for the important word or the point which you have read in the question, then reading of all the four texts will take minimum time. Okay, it will take a minimum time. If you skim and scan whole of the text, whole of the four texts without reading question, then it takes a lot of time, as you think that, oh, this information is really important, this can come in the question, but no. So it's better that read the questions first, then you will have an idea that which type of information are being asked in the question, and then you will search for those information or those points or those words in the text. It will save your time. So guys, you have read your question in 1 minute and 30 seconds, and now you are reading your four text in 4 minutes. So in this way, in 4 to 5 minutes you can read questions and text. Now you have almost 9 to 10 minutes to answer the questions. Okay, now you will have 9 to 10 minutes to answer the question, which can be done very easily in 7 to 8 minutes, as you have a clear idea about type of question and answer. Okay, so guys, now what you have to do is first answer question 8 to 20, then answer first 7 question. This is old strategy, and you have to do same here as well. First you will answer question 8 to 20, then you will move to first 7 question, which are matching type of questions. So applying this strategy, at the end you will have 1 to 2 minutes to check your answers, which is very good for your reading part A, and you can score maximum in this strategy. By using this method, I can assure you, you will be able to score 20 out of 20 in the reading part A, which is very important for your reading subtest. If you score 20 by 20 in part A, then you will have to score just 10 from part B and part C, and you will definitely pass your reading exam. So guys, if you directly skim and scan all the four texts, it's mean that if you directly read all the four texts and underline the important information given in the text, as you don't know what is being asked in the question, then definitely you will encircle or underline all the information which you feel that it is important, it can be asked in the questions, because you don't have any idea about the information which is being asked in the question. So definitely it will take a lot of time, almost 7 to 8 minutes, and ultimately at the end you will have less time for answering your question, and ultimately it result in low score in reading part A. So I will suggest that try above method which I have told you right now, and then tell me about that is it working for you or not. You can answer me in the comment box. Thank you. So guys, let's discuss, let's apply the given strategy in reading part A. So you all know that there are four texts, and for each question one to look to the text A to D, and you have to answer on the question paper just in 15 minutes, and your spelling should be very correct. If you have wrong spelling in your answer, then it will be considered as wrong answer. Okay. So guys, when OET reading part A paper is given to you, as I have suggested you earlier, that directly move to the question number 8 and start reading it. You have to do what? You have to scan and skim the questions for important point or word which is being asked in that question. So in question number 8, what is the main symptom? They are asking about main symptom. You have to encircle or underline the main symptom, and keep in mind that in the text you will search for the main symptom. In question number 9, what contribute to obesity and reduce HDL? They are asking about contributing factor to obesity. So keep in mind the contributing factor, and you will search for this in the text. In question number 10, which is the leading cause of death in US? What is the leading cause of death in US? You have to keep in mind US, then you will definitely find the answer of this question. Question 11. What should be administered within half an hour of arrival of client with angina? So if someone is coming with angina in first half an hour, what you will administer, you will definitely find this information in the text. What should be avoided if client exhibit chest pain which is angina unlikely? So if angina is unlikely, what you will avoid? So we will definitely have this answer of this question in the text. Question 13. What is recommended in order to reduce the oxygen tissue demand? To reduce oxygen tissue demand, what is recommended? Keep in mind, reduce oxygen tissue demand. So what is the next step involved in angina assessment protocol if the client resting ECG is normal? So keep in mind, resting ECG is normal. Keep in mind the resting ECG. You will find the answer. What is the next step? So this is the question, and answer will be the next step, which will be given in your text. So then we will move to question 15 to 20, which are fill in the blank type of question, and we will start reading it. Should be a dash should be administered within half an hour. So in the previous question they have asked about within 30 minutes, and here they are asking about what should a dash should be administered within 1.5 hours after arrival. So also keep this in mind. Question number 16. Beta blockers are angiotensin 2 receptor blockers to be administered for dash. So where beta blocker and angiotensin receptor blocker will be given in the text, there will be answer of this fill in the blank. Okay. Question 17. The risk of angina appears higher. So you will search here for some population type of group. I think the risk of angina is higher in dash. Which type of population? I think they will answer in the text. Dash is used to reduce the cardiac workload, which work by decreasing the afterload. So you will search for that which what thing is used to reduce cardiac workload, which work by reducing afterload. Question 19. Dash contribute to the vasoconstriction and platelet activation. So you will search for the information where vasoconstriction and platelet activation is given. Question 20. Sodium diet or clear liquid are recommended depending upon the presence of nausea. So you will search where sodium diet and clear liquids are given in the text. There will be the answer of this question. So guys, here is important point. Now you have read the question A to 20 just in 1.5 minute to 2 minutes. So I will suggest that you read the first 7 questions as well, because for first 7 questions, if you don't read the first 7 questions, then you will read whole of the text, and it will waste your time. So I will suggest that read first 7 questions so that you can have a better idea that in which text this answer is given. So these 7 questions will maximally take your 40 seconds. So let me tell you that how you can read first 7 questions. So how to assessment is they are asking about assessment in which text you will search. Major cause of angina, they are asking about major cause of angina, you will search. Metabolic syndrome, this is important word, you will search for this word in text, and then you will mention here A, B or C, D. Question number 4. It is required to take ECG for the patient with chest pain. It's mean that they are asking about ECG. You will search that in which text ECG is given. So you will answer from that text that it is given in A, B or C, D. Question 5. How acute MI can be managed? Asking about management. You will search that in which text management is given, and then you will simply write here A, B, C or D. Importance of pain medication in management of chest pain. So you will search for where pain medications are mentioned, then you will simply write the answer that text A, text B, text C or text D. Question 7. Greater level of high density lipoprotein. Greater levels of high density lipoprotein in body protect from cardiac illness. So here what is important point? High density lipoprotein. You will search for high density lipoprotein, that in which text these high density lipoprotein are mentioned. Then you will simply write here that text A, B, C or D. Okay guys, I will suggest that please read the first 7 questions with rest of the questions as well, so that you can have an easy way to read the four text. Okay, so let's read the four text now. So this is first text A. Cardiovascular disease is the leading cause of death in United States. That's right. They were asking that in United States, in US, which is the leading cause of death. So this is our answer. Angina pectoris is a clinical syndrome usually characterized by episodes of pain or pressure in the anterior chest. So this is important symptom of angina. The cause of insufficient coronary blood flow. As they were asking in first 7 question that in which text cause of angina is mentioned. So here is cause of angina. The answer of that question will be text A. So the cause of insufficient coronary blood flow resulting in a decreased oxygen supply when there is an increased myocardial demand for the oxygen in response to the physical exertion or the emotional stress. So this is cause of angina, and answer of that question would be text A. So this is text B. In this text, risk factors are mentioned: family history, increased age, particularly women, gender, men, women, especially after the menopause, and race. Risk appear higher in the African Americans. Yes, this was questions asked that increased risk of angina is observed in dash in African Americans. So this is answer. So again, cigarette smoking contribute to the vasoconstriction, platelet activation. Yes, in a question they ask that dash leads to vasoconstriction and platelet activation. So answer of that question would be cigarette smoking. The other risk factor: hypertension, hyperlipidemia, increased total cholesterol, increased LDL, very high increased ratio of the total cholesterol, and HDL greater than 60. So you will read this as well. Okay guys, so obesity, the other risk factor is obesity. Then sedentary lifestyle contribute to obesity and reduce HDL. Yes, this was another question which was asked in the I think question 8 to 14, where this was given that what leads to obesity and reduce HDL levels. So sedentary lifestyle contribute to obesity and reduced HDL. Okay, type 2 diabetes, stress, and metabolic syndrome. So this metabolic syndrome was asked in I think first 7 question, and metabolic syndrome is given in text B. So answer is B. Okay, so then we will move to text C. Presentation with chest pain, assess nature of symptoms, CHD risk factor, physical examination. If angina is unlikely, avoid unnecessary tests. Yes, this was asked I think in last 5 questions, that if angina should be avoided if angina is unlikely, we will avoid unnecessary test. Okay, then manage the risk if definitive inclusion of the CHD essential, consider the MPI. Okay, if angina is likely, what is primary? Able to exercise, normal resting ECG. Yes, yes, this is an important point as well. They were asking about if a normal resting ECG, then what would be the next step? Then if resting ECG is normal, then next step is exercise ECG. So guys, if you keep in mind the important point which you have underlined from the questions, then definitely without wasting any time, you will find the answers of the question being asked previously. So I will suggest that try to keep the points or important information which is being asked in the question. Try to keep that information in your mind. It will definitely help in finding the answers. So this is text D. In management is given in the text D. I think this was asked in first 7 question, that management is given in which text. So definitely answer is D. So let's read the management points. Improvement of perfusion, administration of aspirin immediately. Beta blockers are angiotensin II receptor blockers for the left ventricular systolic dysfunction. Yes, this was asked that beta blockers and angiotensin receptor blockers are used for what? LVST. Okay. Thrombolytic therapy of within 30 minutes. Yes, this was asked that what should be done within 30 minutes. The answer is thrombolytic therapy. Okay. So then it was asked that within 1 hour or 30 minutes, that's mean 90 minutes, what should be done? This is PCI. So guys, intra-aortic balloon insertion should be done to decrease the cardiac workload by decreasing the afterload. So aspirin, beta blockers, possible anti-lipidemics prescribed at discharge. So these are the medication options as well for the management of the angina. Promotion of comfort and the rest analgesics. So guys, if you remember that in first 7 question that is what it was asked that where analgesics or pain medications are discussed in which text. So pain medications are being discussed in text D. So D is your answer. Oxygen to improve the tissue oxygenation. Okay. Maintenance of the bed or chair rest to decrease oxygen tissue demand. Yes, this was asked that what should be done to decrease the oxygen tissue demand. Bed or chair rest should be done to decrease oxygen tissue demand. Okay. Diet therapy, 2 grams sodium diet or clear liquid depending upon presence of nausea. If you remember that it was last question asked that dash sodium or clear liquid depending upon the presence of nausea should be given. 2 gram, I think answer of that would be 2 gram. If you can remember, it was last question, I can remember that. So guys, in this way you will have to read the question first and you have to underline and remember the important point being asked in the question, and then you will search for that important point or the information which is being asked in the question from the given text. So you will save your time and you can answer your questions correctly as well. So this is very important and time saving strategy which can ultimately lead to very good score. So guys, if you have read the 4 texts properly after reading the question, you can answer what is the main symptom, you have underlined this, what are the what contribute to obesity. So in this way you can answer all the 20 questions and you can score very well in part A. So guys, apply this strategy and try to solve the part A with this strategy. So second method is this, that if you start with reading, if you want to start reading with text, I will suggest that read text A and then read all of the question. Just read only text A, don't read B, C or D. Read text A and then read all of the question, then answer the question. After reading the text A, you have to read all the questions, then answer the questions which are from text A and underline or encircle the important word or point in the rest of the question, and then you will search for that important word or point in the rest of the text, that is text B, text C and text D. So guys, you can also improve your part A in the reading with this strategy as well, but for me the previous strategies in which you read the questions first and then you move to the text, it will definitely help you, and I can assure you that inshallah you will be able to complete your reading part A in 12 to 13 minutes. And if you are so slow in reading, by applying this strategy you can definitely you can complete part A in your 15 minutes. Okay guys, so I will suggest that apply this strategy in reading part A and mention your score in part A in the comment box, and I wish you very good luck for your reading exam. Thank you very much. Allah Hafiz.